So Jim, let me take a more horizon view of this.
Okay.
And I'll try and divide my answer in three parts: patients, electronic health records, and storage, which is what EMC does.
Right.
Firstly, I think we need to pay more attention to early detection technologies to transition from where they are today, which is in academic research, to more a clinical approach where you actually try and understand from a larger population perspective where the world is going. For it to become statistically significant, I mean, we need to do a lot more of early detection. That actually bends the cost quite heavily as well. Secondly, I think we need a more concerted effort to increase the use, as Doug mentioned, and the analytics of EHRs. Even though I think there's some initial evidence that EHRs increase the rate of fraudulent use, I think in the long term, EHRs will greatly reduce the more than $750 billion in waste and fraud that is perpetrated on our healthcare system, not just the VA part or the government part, but generally healthcare in the United States as a whole. Finally, I think the issue of data custodian. When you generate all these large amounts of data, who's the custodian? Who manages all this data? And I think at some level, let's paint a picture. If every citizen in the United States had their whole genome sequenced, what would that data look like in terms of size? I mean, this is massive. I think it's about 8 football fields of spinning disks with about 10 stories high, just of disk drives. Wow. I mean, who pays for it? Who manages that kind of infrastructure? And, this isn't a petabyte and exabyte scale. You ask a question, what is a petabyte? So I have a USB drive here. If you put, this is a 1 gigabyte USB drive. I'm sure every one of you guys have this in your keychain. If you take a 2,000 square foot house and stack this floor to ceiling, 10-foot ceiling, I guess, that would be a petabyte. An exabyte is 1,000 such houses. So, I mean, I would say looking forward, I wouldn't be surprised if a large enough hospital does 50 petabytes a year.
Wow.
I mean, this is the kind of data that we're trying to handle looking forward. I think from a federal and state perspective, the HIE, or the Health Information Exchange, has not been mentioned here. HIE is, I think, the hub to many healthcare spokes, EHRs, pharmacies, payers, labs, public health, and patients. So I think that's kind of a broader view of Horizon.
Yeah.